You say you're doing bad things?
Huh?
You say that he's doing bad things. All right, we are recording. So I guess we're doing seizures and syncope. So, thank God. You guys are being quizzed on it. But. All right. A seizure. What is a seizure? Speak up, they can't hear you.
Temporary alteration in brain.
Yeah. A temporary alteration of the brain.
That's called by electrical discharges.
My goal is for you guys to one day just give me the definition that comes to your head, not what the book tells you.
Oh. Like what we think without reading it?
Yeah.
That's what a seizure is?
Yeah.
Like,
Fire. What do you guys think over there? She could hear you, know.
I know, I do.
You sound pretty far.
What was that?
You sound okay. Well, that sounds better. Right now, you were like really far. Like the noise was really far.
All right. So a seizure is where there's a discharge of electrical activity in the brain. Think about it as putting your finger in the socket, getting that shock. So that's a seizure. There are different types of seizures, and they can change your behavior, your mental activity, depending on what's going on. What are the causes of seizures? Okay.
What are the causes?
Yes.
One of the causes is epilepsy.
Okay.
Convulsions.
Well, those are seizures. Convulsions are seizures.
Oh.
To the brain.
injury?
I've seen it with like people who are drug addicts, and then they don't when they don't get the drug.
Underlying
Okay.
defect.
Uh-huh.
Underlying defect.
I see what the weekend did for everybody.
What do you mean? Why? What did you do, guys, for the weekend?
Not studying. I know that much. Oh yeah.
I can't read that.
You guys remember that?
Yes. Got
Remember
it.
put up on the chat too. Didn't it? You what? Over or underdose? overdose, underdose. You can up the screen. So I couldn't find a freaking Apple Pencil anywhere.
Oh, yeah. They're all.
So,
Yeah.
But
You? That's right. Why, I have to call, you have to call. I work from home.
yeah, there's none at Walmart, none at Target, none at Best Buy. Apple Store has them. They're $100. All right, so remember the causes of seizures is AEIOU tips. Alcohol, epilepsy. So somebody was talking about withdrawals, drugs, that's overdose. Or even overdose, as the body's not getting it. Have I talked about, I did, didn't I? Have I talked about withdrawal symptoms?
Yeah.
Oh, I guess I haven't yet because we're not in poisonings. You guys want to hear it now? You guys want to wait till we get to poisoning?
let's hear it.
Okay. So you guys can see the top of my head. Can't see my mouth. I got my mask on.
He says, symptoms of poison.
Just. Yeah. So here's what happens, guys. All right. So I'm a 4-year-old. I'm a 1-year-old. How old is she now? 1.5, 2 years? Anyway, I'm a 4-year-old. And so to keep me happy, what do you do? Give me a treat. And so just to get a treat, I go and I do something adorable. All right. But now, is one piece of candy going to be sufficient? So I want more candy, right? And then what happens with those 2 pieces of candy? Are they going to be enough to make me happy? No. So then I want 3 pieces, right? But now all of a sudden you're like, ay, chamaco, ya deja fregar. No more candy for you. So as a 4-year-old, what am I going to do?
Look for it.
And if I can't find it, how old are your kids?
2.
How's a 2-year-old? What does a 2-year-old do when they don't get what they want?
Fall out.
So am I going to throw a temper tantrum? Scream and cry. I saw this little girl not get what she wanted at the gas station. I was coming back from Florida. No, I was coming back from Tucson, Florida. I was coming back from Tombstone, going back to Tucson. I haven't been in Florida since 2004. Anyway, and she just threw whatever she had in her hand, she fucking threw it on the ground. Now, of course, if that was me, I wouldn't be able to sit for 2 weeks. And so I throw a temper tantrum, right? Well, here's a secret about the body, is that things that make us happy, we want more of it, don't we? And that goes for a lot of things. And when the body doesn't get what it wants, it throws a temper tantrum. And so that's what we call withdrawals. What happens when you don't get coffee, Joanna?
I get frustrated.
You get grumpy. You get bitchy. Admit it. She's like, and so that's what the body's doing. Potential. Nice. I got my speaker to make sure I could hear. So I think we all can hear like in stereo. What you guys are doing over there? Like eating.
Carlos. Carlos.
Carlos drinking.
For the record, water.
Hey guys, you guys don't have to ask to go to the bathroom. You guys are adults. You can get up and walk out whenever. If you don't come back, that's another story. So anyway, so the body's throwing a tantrum. So you get a headache. You can get the shakes. When you've seen people that are going through withdrawals, they'll have the tremors. That's part of what we call the delirium tremens. They have the tremors. They're antsy, like, I need it. It's like me when I'm not getting my nicotine, right? Or coffee. Remember, 4 things make me happy. Sleep, food, nicotine, caffeine. That's the secret to make me happy. Make sure I have all those, all 4, and I'm good to go. The body, how many of you guys saw the movie Ray or Walk the Line?
Which one?
Ray, about Ray Charles with Jimmy Fox, and then Walk the Line with Joaquin Phoenix. How are you guys over there? Did you guys see it?
Yes.
I need to keep working on my list. It's like you won't be allowed to register for my class if you haven't seen any of those movies.
I saw signs.
We're like so past signs.
Yeah, no, but I saw it.
No, we're at Walk the Line and Ray. Did you watch it? Either one? So in the movie Ray, there's a scene where he's forced to go into rehab. And what does he do like the first night, the second night in rehab? Hallucinations, night sweats, seizures, shakes, tachycardia. All right? Because the body likes this good stuff. And when we take it away, it throws a temper tantrum, just like the 2-year-old, the 3-year-old, the 4-year-old. So just think about it as a temper tantrum. Okay? So over underdose. So you're talking about the alcoholic that hasn't gotten his alcohol in a couple days. That drug addict that hasn't gotten their fix in a couple days. Okay? So. All right, so seizure is, there's something wrong with electrical activity inside the brain. Now, we know about the normal seizures, the full body tonic seizures, but there's a lot more to that. Now, when you hear or see the word epilepsy, that's just a catch-all diagnosis. It's not a specific thing, it's a general thing. So if someone's an epileptic, they suffer from seizures, but there's different seizures, as you guys read in your book, right?
Yes.
As far as seizures go, unless you observe them having the seizure, they can be mistaken for other things. So look at what the patient is doing. You see them unresponsive when you show up, look for any type of foaming in the mouth, any type of oral trauma. Look for any incontinence. Later on, actually I'll tell you guys now, people that suffer from incarceritis tend to have a higher number of seizures. What's incarceritis? Anybody know?
Being in jail?
or about to go to jail. Yeah. Incarceritis is they're about to go to jail or they're in jail, they want to get out. So they'll fake a seizure, and of course, they're not trained or equipped. So they'll call 911 or they'll get the medical staff there at the facility. And so you show up and they're just shaking, right? We know it's bullshit. Trust me, most of the time. There's a little test to perform when we suspect they're full of it. And that's the arm drop test. So as they're laying there, right, elevate the fingers or the hand so they're laying down flat, right? Bring the hand up, drop it. If they really are in fact having a seizure, that hand is going to fall right on their nose. How pleasant is it to get smacked on your nose?
Not very.
So what you'll see, or you drop it, it'll completely miss their nose. You know they're full of shit. And then there's a certain ambulance company that were nameless, but they wear blue uniforms. They're a 4-letter word. And it's what we're living right now.
Hint.
No, I'm just picking on them because I know they do it. I don't know if Philly or Dominion do it, but they use what they call booty sugar. Why you're going to want to drop their trousers and spread their ass cheeks to insert a syringe in their butt is beyond me, unless you like that kind of stuff. I don't go for that, but hey, to each their own. Okay? That's what they do. They will drop their pants, they will take off their underwear, they'll spread their butt cheeks to get to the anus, and they will get that D50 and put it in the butt. I don't agree with it. I don't teach it to my advanced students. I don't recommend you doing it. But anyway.
So then what's the benefit of doing that?
To see if they're faking it.
Oh.
Right. If somebody dropped their pants and put in the syringe up your butt, would you react?
Not if they're practicing for being in jail. Just kidding.
Yeah, there are some that might enjoy it, but there's others that might not.
That's just crazy. It's gross.
If I just told you I don't recommend doing it,
Well, I don't know.
you gotta remember I used to work for that company.
Oh,
And I had their employees and they would tell me about it. And I was like, no. No.
Wow.
All right. So as far as seizures, there's several different things going on with seizures. Like I said, there might be a reason why they had a seizure: chemical imbalance, head trauma, alcohol withdrawals, or any type of withdrawals. As you see behind me, ARU tips. But sometimes they happen for no known reason. My seizures were for no known reason. The only thing my mom could think of was I fell in a hole and I got scared shitless. And I started having seizures after that. And then the next thing you know, well, it was several years. I was sick for a bunch of years. Next thing you know, I don't have any more seizures. So when they say, have you ever had a seizure? I should say yes, but I say no, because there's no proof. Because thankfully my documentation's in Mexico. But that was like so last century. So. So there might be reasons why. There. Here I am, I'm shaking. What am I not doing very well? I don't say acting. I'll have issue with my airway. I'll have issues breathing because I'm tense, right? I locked up. What's that phase called? The tonic phase, right? I stiffened up. So oxygenation is a big issue. So if that seizure is going on for 5 minutes, what do you think? No, I'm seeing here your book says more than 30 minutes. Yeah, they really are status. It's really if lasting a seizure lasting more than 10 minutes, 3 or more seizures in an hour is what I learned also. Or having another seizure before regaining consciousness from the previous seizure. So one of my rules when you guys are going to be in class is phones are going to be put away. There's no reason to have your phones on or out here. So those are 3. If the patient is positive any of those 3, they're what we call status epilepticus. It means they're bad. So what were those 3 again? A single seizure lasting more than 5 minutes. 3 or more in an hour, or without regaining consciousness from the previous seizure.
And not regaining consciousness?
Yes. Do you remember how many minutes it was, Valeria?
What was the question?
Do you remember how minutes it was about seizure lasting longer than what?
Longer than 10 minutes?
Huh?
Longer than 10 minutes?
Okay, we'll go with 10 minutes. You keep changing it up on me. That's status epilepticus. Okay, so types of seizure. So we've been talking about the most common one. And that's what we call the tonic-clonic seizure or the generalized seizure. What was the name that we used to give that to before? Or what was the old name? What's the name of that seizure? What did we call the generalized seizure or the tonic-clonic seizure before?
Grand mal seizure.
What?
Grand mal.
Grand mal seizure. And what are the stages of the grand mal seizure?
The first stage is the warning stage?
What do we call that warning stage?
Aura stage?
Yeah, the aura.
Aura stage?
A-U-R-A, aura. No.
Loss of consciousness?
Fine, listen to your book. Loss of consciousness, and then
Good job, Jose.
the tonic phase,
And then the clonic phase.
and then, no, you forgot the hypertonic phase.
Hypertonic?
Registry, it's those 4 levels, the aura,
Oh,
the 4 stages, the aura, the tonic, the clonic, and the post-ictal. Did you just see the question? It's okay. Remember, I'm a 4-year-old. ¿Verdad, Pechocita? That's what she is. She likes to be close to me. She doesn't like it when I leave. And she's usually waiting for me at by the door.
You know,
Yeah. Or if I leave for a little bit, she'll be right there. If I'm not home right away, like when I come here, she'll get tired. She'll go with my mom. My mom's out of town, so that's why I brought her with me. She's not by herself. Good, Chiquita. All right, so I'm having a tonic-clonic seizure. What are you gonna do for me? Okay, what about the airway? What?
Make sure it's clear.
How?
Make sure you're not swallowing your tongue or biting your tongue. No?
All right, so we're in school. So I'm hearing you want to open up the airway and suction. What did the tonic phase do? Your muscles locked up. So how successful are you going to be to open up that mouth? You won't. Number 2, is your tongue attached inside?
Yes.
So is there a danger of you going, yummy, it needed a little bit more salt?
Yes.
Huh? How is it possible to swallow your tongue?
You bite it off.
If you bite it off. But short of that, how can you swallow your tongue? You can't. Are you going to open up their mouth and put a spoon in it? No. Are you going to put a wallet in it? You risk losing whatever you put in it. Your fingers, whatever. You're going to cause trauma to your patient. So, give them oxygen. Trust me when I say this. Yes, I could be a pompous ass. A couple of weeks ago, Memorial Day weekend, had a seizure patient out of the jail. She was having a seizure. Here's the thing, the day before, my boss took her into the hospital. They released her, back she goes. Now, while my boss was transporting her on Friday, she had 8 seizures on the way to the hospital. And what they did was they kept changing the amount of oxygen they were giving. And she gave one drug first, which didn't do anything, and then she gave the correct drug, and finally the seizure stopped. But she had 8 seizures along the way. The next day, I get called out about 11 o'clock for the same patient. They're kind of looking at me weird that I don't want to put her on a backboard. Number 1. Number 2, remember I told you, did I ever tell you the story of the lady, the hypoxic lady, that they had her on a nasal cannula in the emergency room? Actually, I wouldn't even fucking call it that. You guys know me. You know I have an attitude and I have a temper, right? So we go get this lady. And so I'm getting a report. My partner goes and then he's like, Lou, check this shit out. They have this lady on an infant nasal cannula. How big are those flipping prongs? They're tiny. They're tiny. Out. 1 or 2 liters, I don't remember. 1 liter, I think it was 1 liter. Via nasal cannula. This lady is a smurf. She's cool, diaphoretic, cyanotic, the whole 9 yards. Do you think that oxygen is sufficient to help her out? No. What do you think I did? Again, you guys knowing me. No. Worse. No. I yanked it off the wall and I chucked it across the floor. Across the ER. I've been this way for a while. It's nothing new. Right, Valeria?
Yep.
She's agreeing. Jeez. So this lady with the seizure, this time she's on 1 liter also on a child, 1 liter on a child cannula. Hello? Throw her on high flow, 15 liters of non rebreather. So we switched her out. 4 seizures, right? 4 seizures before we got there. We get in the back of the truck, we put her on the O2. I tell my partner, drop a MPA in her. She woke the fuck up right away. So maybe she was faking it, but she did have a history of seizures. It's documented. But in this case, she woke right up. I know one of my classes got an MPA in their nose. Was that you? How did it feel?
I don't know. Yeah, it didn't feel that bad.
It was a lot.
It was, yeah, it
It was
was
like
like
super tall.
Well, they measured it, but still.
Do you guys putting things up your nose? Or getting things put up your nose?
It's just a thought, really, that scares you.
Oh, it was nice and globby with KY. So she woke up pretty quick, but she was out. But anyway, maybe she was fearing the MPA, I don't know. But put her on 15 liters via non-rebreather, and I went straight to the medication that she was supposed to get, midazolam. I didn't give her all of it. She was small. She had 1 seizure on me, and that was early on in the transport, before the oxygen level got high enough to prevent another seizure. So 8 in the transport the day before, 1 with my transport. Throw them on the O2. The O2 is going to increase the threshold for a future seizure. In other words, it makes it less likely they're going to have another seizure. Me da pesochita. All right, what else? So O2, you're not going to suction because you're not going to want to open the mouth. That's why I've always been reluctant when people have talked about the opening up the airway or the mouth with a finger, scissor, whatever.
The second.
I don't put my fingers in mouths. I'm sorry. I don't know where your fingers have been.
Okay. Oh, because it's tensed up.
Can you put them on the lateral recumbent position? Yeah. And why do we put them in lateral recumbent position? Recovery position? Huh?
Oh, yeah, that's what the recovery position.
But why? Okay, so they're an aspirate, but more specific. You're right. It has to do with the airway. What about the airway?
Choking on, like, on the vomit and the secretion, like, foaming and stuff like that. Like,
Maybe, but it's kind of going to this. What do you guys think? Why do we put them in the recovery position? It's a simple answer. It has to do with the airway.
The tongue?
So normally they can't protect it. So what?
So they don't choke in with their saliva?
Or tongue?
So we want to make sure we keep the airway clear. So basically it's to keep the airway open, to protect the airway. So you're dancing around it, but yeah, it has to do with the airway. Put him in the recovery position. Okay. All right. What else? It's real simple, guys. Before transport, move anything that they could hurt themselves with. So move anything, protect them from further harm. So if there's any tables, chairs, sofa, anything there that they can hit, so just let them have the seizure. But
Do you strap them?
huh?
Like, do you strap them?
Not so tight because you don't want to hurt them. Now be very careful when they do come out of that seizure because they're going to be postictal. It's that recovery phase. What you have to think about is when they're in that postictal phase, they've expended enough energy for the equivalent to run a marathon. So they're going to be tired. But when they start coming around, they start gaining consciousness or regaining consciousness, they might be combative. I'll never forget the time this young cop straddled this seizure patient, and finally the guy, he was being combative, he sat up and bit the cop in the inner thigh. Missed the boys by not very much. We were all laughing at him. It was funny. So don't straddle them and be careful. Expect them to be combative. Okay? All right, I wanna make a bet with you guys. Anybody want to take it? So I got to take her over here that wants to make the bet. So, Mr. Anna, is it okay if he speaks for the whole class?
Oh, all right.
Who is it?
Chickening out. Jonathan?
Andrew.
Andrew, sorry. Andrew.
I don't know. What to
All right,
say?
you want to make the bet for the class?
No.
Any of the officers want to take the bet? Here's a bet. If you guys
No,
win,
gamble.
I was about to say you all get 100 if you guys win for a quiz, but okay, no gambling.
I gamble.
Y'all can do it. Y'all can do it. I don't have to.
What was that?
Y'all can do it. I don't have to.
It's a real simple thing.
Kelly got this.
What is it?
So I'll bet you guys that every one of you has had a seizure at one point in your lives. Quiet, Miss Valeria. Quiet.
Yes,
do anything.
that's true. That's true. The ones that we call brain farts are the ones that you just like the ones you get stare.
What do we call that?
I don't know, but I know that those are it. Some of them.
Yeah.
It starts with an A. I know that for sure.
Yeah. It's the absence seizure or the old petit mal seizure.
No.
We said it.
Yeah, we all answered it.
She didn't want it.
We all
We
said
said
yes.
yes.
You said somebody was going to take it.
Yeah, so we said yes, so
Yes,
maybe
everybody-
in the class.
Everybody gets 100.
The vice president didn't want anybody to do it.
Oh.
I never said that, guys. He's lying. I never said that. I said I won't do it, but y'all can. Nope. I did not say that.
You answered correctly. That's y'all got.
I'm just gonna mute. I'll just mute.
By the way, I put quiz grades on Teams. One of the files I put up, you'll see current quiz grades. I haven't adjusted the overall grades, but if you have a 0, you got to the end of the week or those zeros are staying. And if your grade, honestly, your grade is too low, I would consider switching over to the next class because you're not going to make it up. Get it done. Let me know this week which quiz, and I'll be opening them up.
Yes, sir.
Quizzes. You guys got quizzes?
Up to date now?
Huh?
We're pretty much up to date if we like took everything once.
Yeah, well,
we take
the
it.
grade sheet is on Teams. If you have red and it has a 0 on there, it means I don't have a quiz for you. So you need to make up that quiz. If you've done all the quizzes, then you're going to be fine, but just look at it to make sure. Okay, because if you say you took the quiz, then it's on my end. But that's just what I have. All right, you guys will all get 100% CPR. It's a quiz break.
Lou,
Yes?
sorry for interrupting. Oh, never mind. It just refreshed. Sorry. I was looking at the grades. Mine was still showing 6.9, not 6.22.
All right, so moving on. So yeah, with the absence seizure, it is a daydream. So somebody could be talking to you and all of a sudden they just blank out. And within a few seconds or so, they start coming down. Yeah, it's just a sharp limit. You know, somebody has a needle and anything right behind you. Huh? No, it's not. All right. All right, myoclonic. There's other types of seizures. Some involving just muscle jerks. There are some like tonic where they stiffen up. There are some where they. I've seen a lady where she stiffened up like this, started masticating. They have Jacksonian. I think it's Jacksonian where they start like in this muscle group and then they keep moving, spreading. So like a person will have start stretching on the finger and then it involves more of their upper extremity and it moves and things like that. The main thing with seizures is there's different types. It just depends on what kind of activity. Okay. We're really concerned about the tonic-clonic or the generalized seizures because of the fact that there's minimal breathing, they've lost consciousness, and they might have injured themselves. Number one. The second thing for seizures is if it's the first time they've had seizures. Why did they have a seizure? Well, we can look at the causes, but according to chemical imbalance can be trauma. What is causing that seizure? Now, once someone gets diagnosed with seizures, now guys, this is my experience talking. Okay, this is my experience talking. If you have a patient that's had a seizure and they have a history of seizure, they really don't need to go to the emergency room. They have a history of it. Somebody around them didn't know, or they just kind of, oh my gosh, they freaked out and they called 911. If they don't want to go and they have a history of seizures, they don't have to go. You know what they're going to do at the hospital? They'll do a blood draw, check their levels, their medication level. They're going to give them some food, make sure they don't have another seizure, and then cut them loose. Look at my prisoner that had seizures 2 days in a row. as many seizures as she had, she went back that same day. Or she went back to the facility the same day. The next day, here we go again. They have a history of seizures. They really don't get off. Was that you, Carlos? Jose heard you. He's laughing over here.
I'm so sorry, guys. That's my bad.
But I was about to talk about that next. But yeah, it's what we call benign. So I'm that 4-year-old again. Was today hot?
Yes.
And I've been outside playing all day. Or better yet, I've been sick. What's going to happen to my body temperature when I'm sick or when I've been playing outside all day?
Go up. It's gonna go up.
It goes up. So what can happen to me? Oh yeah, but I could experience a febrile seizure. Means a seizure that's being caused by a fever. So why am I having a seizure?
The fever.
But there's more to it than that.
High temperature?
What was that?
High temperature?
Okay, but what about the high temperature?
Would it be brain damage? Brain cell damage?
You know,
No?
It says the magnitude and peak. So like how high it got, that's what causes the seizure.
expand.
Like you're not gonna get a seizure if you have like say 100.1, but if you're at like 104, it's so hot that your body starts to have a seizure.
Are you gonna have a seizure?
Yes, most likely.
What condition are you in if you're gonna have a seizure?
You're like sick. Well, if it's a febrile seizure, you would be sick. Like maybe you have like an infection or something.
You're not gonna have a febrile seizure. Yeah, if you have a seizure as a result of heat, you're suffering heat stroke. You're a severe emergency. Okay? That 4-year-old kid that's having a febrile seizure, I'm not to say that it's not an emergency. It is for the parent.
Mhm.
For us, it's not. It's benign. In other words, I don't need to take them to the hospital. They're going to be fine.
Like, a febrile seizure, but if
So you just cool them down.
it's not
Petite mal seizure?
benign.
No, I'm saying you just had a petite mal seizure. No, like if Vanessa's having a seizure, it's a result from heat stroke, which is it's a life-threatening emergency.
Yeah, I got that.
Okay, it's the 4-year-old that it's not. Oh, it's benign.
Yeah, that's what I'm.
BENIGN. Benign. We're not in treatment yet. Right now, I'm just talking about the fact that I'm having a febrile seizure. I'm a little kid. My body is still developing, correct? And so our little bodies don't know how to adapt to that rapid rise in temperature. It's a very quick rise in temperature. So all our little bodies could do is just shut down and have a seizure. That's why it's benign. Now, I can tell you, being Mexican, and all the other Mexicans around here and online can vouch for this. When the little kids get sick, what did our parents, grandparents, aunts, uncles, everybody do?
Bundle them up.
Bundle them up, towel on the head, do all this stuff, right? Because, oh, we don't want them to catch pneumonia. You cannot catch fucking pneumonia by going outside after showering. I'm sorry. I hear that so much. Even my mom says it, and I just look at it.
We were raised like that.
I know we were. I'm older than all y'all, so I know. Don't go outside after being inside. Don't go outside after having taken a shower.
Cover your chest and cover your mouth so the cold air doesn't hit your face.
So you see the little kids bundled up. So what is that doing to the body temperature when they have a fever?
Raising it more.
Yeah, it's not dissipating. How do we lose most of our heat?
From our head. Through our head.
I'll say it again.
Because our feet.
What were you guys saying over there?
Through our head.
Through our head. Remember the Little House on the Prairie where they wore the nightcaps? Bonnets to sleep? That was to help keep them warm at night. They didn't have central heat.
Bonnets on babies, like hats on babies when they're born.
Yes, to keep that heat in. So you're not allowing them to dissipate. So the treatment when we get there for a febrile seizure is you strip them down to their bare diaper. And then you cool them down by patting them down with tepid water. What's tepid water mean? Room temperature water?
Sure.
You pat them down or cool them down until they start to shiver. Once they begin shivering, you stop cooling them down, cover them up, and wait for them to stop shivering. Once they stop shivering, open them back up, cool them down again. Do that until the temperature is normal. I had one kid that his eyes, I shit you not, were rolled up into his head. As soon as he was cool enough, the eyes came back down. Now, new parents, ay, mijito, mijita, right, Valeria? It's like they get the sniffles right away, you're on the phone with the pediatrician. Right?
No.
It's like, no. No.
No.
Most new parents, the kids get, how were you with your kid, with your son? Most new parents are. So, if they want them to go to the hospital, that's fine, but they're benign, means that it doesn't mean anything bad. It's just once their bodies are cool, it didn't affect their brain, it didn't do anything. It's just a safety mechanism that kids have to try to cool down. Because the shaking, well, shaking actually generates heat. But it's their little bodies shutting down. Okay. All right. So we talked about the assessment part of it. We talked about the treatment part. With the assessment part, the very first iPad I had, which was an iPad 2, I did drop it. I had it, and it fell down, and somehow the corner found the concrete. It cracked it. And so I spent it was only like $300 for a new one. I need to get a better protective cover. It's just temporary.
I'm done with you right now.
Yeah. All right. So you look for these things. Look for a medical alert tag that they have epilepsy. Ask about medicines that they might be on. Anybody know what kind of medicines they'll be on for seizures?
Neurontin.
Huh?
Like Neurontin, stuff like that. Crap, what are they called?
Peanut butter ball.
No.
Yeah, peanut butter balls.
What? I can't think.
It's phenobarbital, but we call it peanut butter ball.
Peanut butter ball. That's a good way to remember it, I think. Phenobarbital.
Dilantin. Neurontin.
What are they called? They're called something else, like.
They're anti-seizure meds.
No, but there's another word for it.
Anti-seizure.
Epileptics?
No, I don't know what I'm thinking. Anti.
Narcotic?
Convul.
Yeah,
Convulsive.
also.
Anti-convulsive something.
Ask about any recent trauma, any recent illness. How long has it been going on for? What activity did they see? Any muscle stiffening, tightening, jerking? Did they eat or drink anything prior?
Anticonvulsants. That's what I was looking for. Anticonvulsants.
Oh, what else? There's something else I was thinking. Trauma, illness, meds, food, substances. So just observe them. Again, you want to protect them from further harm. So, anything I need to go over? Keep touching on in the book. Okay then. Let's be back at 8 o'clock. ¿Qué pasó, pesorita?